NMC CBT questions and answers. Question number 201. The UK regulator for nursing and midwifery professions within the UK with a stated aim to protect the health and well-being of the public is Option A GMC, Option B NMC, Option C BMC, Option D WHC. The correct answer is Option B NMC. Question number 202. Mental Capacity Act 2005 explores which of the following concepts? Option A mental capacity, advanced treatment decisions, and Act's code of practice. Option B mental capacity, independent mental capacity advocates, and the Act's code of practice. Option C mental capacity, advanced treatment decisions, independent mental capacity advocates, and the Act's code of practice. Option D mental capacity and the possible ethical and legal dilemmas in its interpretation. The correct answer is Option C mental capacity, advanced treatment decisions, independent mental capacity advocates, and the Act's code of practice. Question number 203. Gabriella is a 26-year-old woman with severe learning disabilities. She is usually happy and outgoing. Her mobility is good. Her speech is limited, but she is able to be involved if carers take time to use simple language. She lives with her mother and is being assisted with personal care. Her home care worker has noticed bruising on upper insides of her thighs and arms. The genital area was red and sore. She told the care worker that a male care worker is her friend and he has been cuddling her, but she does not like the cuddling because it hurts. What could possibly be the type of abuse Gabriella is experiencing? Option A discriminatory abuse. Option B financial abuse. Option C sexual abuse. Option D institutional abuse. The correct answer is Option C sexual abuse. Question number 204. A staff nurse has delegated the ambulating of a new post-op patient to a new staff nurse. Which of the following situations exhibits the final stage in the process of delegation? Option A having the new nurse tell the physician the task has been completed. Option B supervising the performance of the new nurse. Option C telling the unit manager the task has been completed. Option D documenting that the task has been completed. The correct answer is Option D documenting that the task has been completed. Question number 205. What is meant by an advocate? Option A someone who develops opportunities for the patient. Option B someone who has the same beliefs as the patient. Option C someone who does something on behalf of the patient. Option D someone who has the same values as the patient. The answer is Option C someone who does something on behalf of the patient. Question number 206. According to the Nursing Code of Ethics, the nurse's first allegiance is to the Option A client and client's family. Option B client only. Option C healthcare organization. Option D physician. The answer is Option B client only. Question number 207. A young mother who delivered 48 hours ago comes back to the emergency department with postpartum hemorrhage. What type of PPH is it? Option A primary postpartum hemorrhage. Option B secondary postpartum hemorrhage. Option C tertiary postpartum hemorrhage. The correct answer is Option B secondary postpartum hemorrhage. Question number 208. Client is admitted to the labor and delivery unit in active labor. During examination, the nurse notes a papilla lesion on the perineum. Which initial action is most appropriate? Option A. Document the finding. Option B. Report the finding to the doctor. Option C. Prepare the client for a C-section. Option D. Continue primary care as prescribed. The answer is option B. Report the finding to the doctor. Question number 209. The nurse is monitoring a client with a history of stillborn infant. The nurse is aware that non-stress test can be ordered for the client to: Option A. Determine lung maturity. Option B. Measure the fetal activity. Option C. Show the effect of contractions on fetal heart rate. Option D. Measure the well-being of the fetus. The answer is option B. Measure the fetal activity. Question number 210. A primigravida, age 42, is 6 weeks pregnant. Based on the client's age, her infant is at risk for: Option A. Down syndrome. Option B. Respiratory distress syndrome. Option C. Turner's syndrome. Option D. Pathological jaundice. The correct answer is option A. Down syndrome. Question number 211. Which is not a stage in the Tuckman theory of contingency? Option A. Forming. Option B. Storming. Option C. Norming. Option D. Analyzing. The correct answer is option A. Forming. Question number 212. Causes of diarrhea in Clostridium difficile. Option A. Ulcerative colitis. Option B. Hashimoto's disease. Option C. Pseudomembranous colitis. Option D. Crohn's disease. The correct answer is option C. Pseudomembranous colitis. Pseudomembranous colitis, PMC, is an acute, exudative colitis usually caused by Clostridium difficile. PMC can rarely be caused by other bacteria. Question number 213. Except which procedure must all individuals providing nursing care must be competent at? Option A. Hand hygiene. Option B. Use of protective equipment. Option C. Disposal of waste. Option D. Aseptic technique. The correct answer is option D. Aseptic technique. Question number 214. Which of the following would indicate an infection? Option A. Hot, sweaty, a temperature of 36.5 degrees Celsius, and bradycardic. Option B. Temperature of 38.5 degrees Celsius, shivering, tachycardia and hypertensive. Option C. Raised WBC, elevated blood glucose and temperature of 36.0 degrees Celsius. Option D. Hypertensive, cold and clammy, and bradycardic. The correct answer is option B. Temperature of 38.5 degrees Celsius, shivering, tachycardia and hypertensive. Question number 215. One of your patients in day 1 having episodes of vomiting in the last 2 days now. The norovirus alert has been enforced. The other patients look concerned that he may spread infection. What is your next action in the situation? Option A. Seek the infection control nurse's advice regarding isolation. Option B. Give the patient antiemetic to control the vomiting. Option C. Offer the patient a lot of drinks to rehydrated. Option D. Tell the other patients that vomiting will not cause infection to others. The correct answer is option A. Seek the infection control nurse's advice regarding isolation. Question number 216. If a patient is experiencing dysphagia, which of the following investigations are they likely to have? Option A. Colonoscopy. Option B. Gastroscopy. Option C. Cystoscopy. Option D. Arthroscopy. The correct answer is option B, gastroscopy. Question number 217. A nurse is preparing to deliver a food tray to a client whose religion is Jewish. The nurse checks the food on the tray and notes that the client has received a roast beef dinner with whole milk as a beverage. Which action will the nurse take? Option A, deliver the food tray to the client. Option B, call the dietary department and ask for a new meal tray. Option C, replace the whole milk with fat-free milk. Option D, ask the dietary department to replace the roast beef with pork. The answer is option B, call the dietary department and ask for a new meal tray. Question number 218. Concentration of electrolytes within the body vary depending on the compartment within which they are contained. Extracellular fluid has a high concentration of which of the following? Option A, potassium. Option B, chloride. Option C, sodium. Option D, magnesium. The correct answer is option C, sodium. Question number 219. Which of the following is not a cause of type 1 hypoxemic respiratory failure? Option A, asthma. Option B, pulmonary edema. Option C, drug overdose. Option D, granulomatous lung disease. The answer is option C, drug overdose. Question number 220. Your patient has bronchitis and has difficulty in clearing his chest. What position would help to maximize the drainage of secretions? Option A, lying on his side with the area to be drained uppermost after the patient has had humidified air. Option B, lying flat on his back while using a nebulizer. Option C, sitting up leaning on pillows and inhaling humidified oxygen. Option D, standing up in fresh air taking deep breaths. The correct answer is option A, lying on his side with the area to be drained uppermost after the patient has had humidified air. Question number 221. You are the nurse assigned in recovery room or post-anesthetic care unit. The main priority of care in such area is option A, keeping airway intact. Option B, keeping patient pain-free. Option C, keeping neurological condition stable. Option D, keeping relatives informed of patient's condition. The answer is option A, keeping airway intact. Question number 222. An 18-year-old 26-week pregnant woman who uses illicit drugs frequently. The factors in risk for which one of the following? Option A, spina bifida. Option B, meconium aspiration. Option C, pneumonia. Option D, teratogenicity. The correct answer is option D, teratogenicity. Question number 223. The nurse is discussing breastfeeding with a postpartum client. Breastfeeding is contraindicated in the postpartum client with option A, diabetes. Option B, HIV. Option C, hypertension. Option D, thyroid disease. The correct answer is option B, HIV. Question number 224. The client with preeclampsia is admitted to the unit with an order for magnesium sulfate. Which action by the nurse indicates the understanding of magnesium toxicity? Option A, the nurse performs a vaginal exam every 30 minutes. Option B, the nurse places a padded tongue blade at the bedside. Option C, the nurse inserts a Foley catheter. Option D, the nurse darkens the room. The correct answer is option C, the nurse inserts a Foley catheter. Question number 225. A client who delivered this morning tells the nurse that she plans to breastfeed her baby. The nurse is aware that successful breastfeeding is most dependent on the Option A, mother's educational level. Option B, infant's birth weight. Option C, size of the mother's breast. Option D, mother's desire to breastfeed. The correct answer is option D, mother's desire to breastfeed.